And now, ladies and gentlemen, moving further, we'll be taking the chairman's remarks, and this will be done by a visionary leader, one whose work has transformative impact and has had impact as well, from shaping medical research and training in Nigeria to implementing nationwide health reforms. And I am talking about none other than the former Honorable Minister of Health, Professor Isaac Folorunsho Adewole. Please, a round of applause for Professor Isaac Folorunsho Adewole, the former Honorable Minister of Health, as he comes to give his chairman's remarks. Please don't stop clapping until he gets on stage. We can do better with the applause. Thank you so much.
Thank you, Blessing. My immediate predecessor in office, one of our teachers said, when you leave office, you become immediate past, then you can become former, and then once upon a time. So if I'm former, then Professor Chukwu could be once upon a time former Minister of Health. Distinguished participants, esteemed researchers, policy health experts, policy makers, development partners, colleagues, ladies and gentlemen. It is my immense pleasure to welcome you warmly to the ARISE annual meeting and conference on adolescent health in Sub-Saharan Africa. I'm particularly delighted to meet Wafai, the chief midwife of ARISE, and I could remember Wafai playing host to us in Harvard in 2014. Thank you, Wafai, for that meeting that has given rise to ARISE. I also want to appreciate Professor Adewole for his non-tiring effort in leading the UI Research Foundation that we both established also during my tenure as Vice Chancellor. I want to thank Sanjana. Sanjana was working with UNICEF when I was in office, and we tried to do a few things together. Thank you for your support. And when I got here this morning, I said, oh, Sanjana is in UNICEF. Someone said he's now in Gates. And I said, that is a big loss to UNICEF and a big gain to Gates Foundation. Congratulations, Sanjana. This gathering unites a diverse and distinguished group of scholars, policymakers, youth leaders, development partners, and practitioners from across the continent and beyond, all committed to advancing the health and well-being of Africa's most vital population, its adolescents and young people. Africa is host to about 50% of world's young people. And to me, if we're utilized, that could really yield a huge demographic dividend for us in Africa because of the resilience, the passion, the commitment, the energy of the young people. But if we fail to utilize that abundance of energy, then we could reap demographic disaster. So it is important that we do not allow this opportunity to go by without tapping into it. For me, this moment is particularly meaningful, not only as an invited guest or a participant, but as someone who started this journey in 2014. I'm quite delighted that ARISE has grown into a formidable platform for collaborative research, capacity building, policy engagement grounded in African realities and driven by global relevance. I'm also happy that we are keen to adolescent health and related issues because this is the subject of the moment. I'm sure we are aware that last month, the Adolescent Commission actually released the second report on adolescent health. And that report is quite instructive. Tedros, the WHO DG, said, our young people are the leaders of tomorrow, but they are the change makers of today. He went on to add in the op-ed that the investments that we make today will determine the future of families, communities, societies, economies, and our planet. And the progress we make with investment in young people will also go a long way to determine how much we realize with respect to the SDG. This conference is more than a routine academic event. It represents a strategic milestone in a collective journey towards achieving health equity, research excellence, and creating a future where no young person is left behind. At a time when the challenges facing adolescents are as complex as they are urgent, these gatherings remind us of the possibilities that arise where we unite evidence, partnership, and purpose. The problems of adolescents are too huge to enumerate. They include early and unwanted pregnancies, a large number of school dropouts. West Africa alone has about 30 million young ones out of school, and Nigeria has about 50% of those out of school children. Also, a large number of these get pregnant even before they mature. 14% of young ones are married before 15 years, and 41% of our young people are married before age 18. Back in 2014, when we came together to form what is now ARISE Network, we were driven by shared vision to advance science, support policy, and strengthen capacity across Africa. Through collaborative research, that vision has flourished over the years, creating a real-world impact on communities, systems, and policies. During my tenure as Vice Chancellor, I facilitated the establishment of the University of Ibadan Research Foundation. And once again, I want to thank Professor Adewole for leading the foundation and for all we've been able to achieve over the years. The foundation was created to promote cutting-edge research in our university, strengthen and support the university's research ecosystem, and foster a culture of continuous professional and career development of academic and research staff. I'm proud that the UI Research Foundation has remained not only a cornerstone of Nigeria's research ecosystem, but also a vital member of the ARISE network. The theme of this year's conference, Bridging Gaps, Building Futures, multi-stakeholder platform for asset-based, impact-driven strategies and policy options for adolescents and youth health in Africa is timely and very appropriate. Thank you for choosing this wonderful theme, and I'm sure when we address this, we stand to gain the triple dividend that people talk about. The triple dividend will include the gains in the adolescents themselves today, the gains we will have when they grow into adults tomorrow, and the generation gain that we have even when they produce offsprings. So we are not only investing in today, we are also investing in tomorrow. Thank you for your vision. I commend the ARISE network and the University and all partner institutions and funders, particularly the German government, for sustaining this vision over the years. Special appreciation goes to our youth participants, early career researchers, and frontline implementers who continue to push and drive change where it matters most. As we officially commence this important meeting, let us remind ourselves that our purpose here transcends academic discourse and technical exchanges. This is not merely a conference. It is a generational call to action for a new generation. It's about building bridges where gaps have long existed and laying a strong foundation for futures we may not fully see but must boldly shape. Let me also appreciate you for the choice of your keynote speaker, my predecessor in office, who also laid a strong foundation in the Federal Ministry of Health. Thank you, Professor Chukwu, for agreeing to deliver the keynote address at this meeting. The network, the work that this network is doing is a legacy work. And I want to plead that we continue in spite of the global challenges that we face. Global warming, cut in development funding, war and crisis all over the world. We are dealing with a generation that can only talk about war and crisis. Yet we must not give up. We must not lose hope. Hope should be our strength. Hope should be our watchword. Let us therefore approach this gathering with a shared sense of urgency, humility and hope. Recognize with a shared sense of urgency the strategies that we craft, the policies we shape, and the alliances we forge. Here, we have a lasting impact far beyond the walls of this complex. Adolescents are not only passive recipients of policy outcomes, but we should see them as co-designers of programs that affect them. May your discussions in the coming days be deeply insightful, strategically impactful, and profoundly inspiring for the adolescents of today and for our future generation. God bless you. God bless the Federal Republic of Nigeria.
Let's try that again, do better. A round of applause for Professor Isaac Folorunsho Adewole, the former Honorable Minister of Health. Thank you so much for those profound words. And one of the things that he said towards the end of the speech was that this is a legacy movement, and one to remember that it also is a call to action. And that said, we'll be going to the next segment very quickly. Just to remind you that this is a conference on adolescent health in Sub-Saharan Africa with the theme Bridging Gaps, Building Futures, a multi-stakeholder platform for adolescents and youths in health in Africa. Now, you've heard us say that this is a call to action, and one that prioritizes execution over planning.